Morning, everybody. Oh, we got a few in already. All good. Everyone's excited for lymphatics. Good morning. It's February already, and yeah, a bit of a change from the usual, which has been quite nice actually. Something that I've not looked at for quite some time. So yeah, we're going to have a look at the lymphatic system today. It's a little bit different from what we would normally do. Not as visual today because of the it, on cadavers. I think I've mentioned this before, but when they're preserved, usually with a, a chemical called formaldehyde, and the formaldehyde it kind of disintegrates the lymphatic system, and it doesn't. You can't really see it, so you have to look at like what we call it. It sounds really horrible, but you have to look at fresh cadavers, so ones that have been frozen rather than before they've been embalmed. And there aren't very many images of it, of the tissue. So I found one. I found a paper where there are some kind of inguinal nodes, but then they've coloured them green, which where we always say it doesn't look like it does in the textbooks, but they've made it look like it does in the textbooks because lymphatics are always green, aren't they? Blood vessels are always red and nerves are always yellow. So yeah, I've managed to find some images, so it's going to be a little bit different today. You're welcome. Yeah, no problem. So hopefully, I think it might need to be spread across 2 sessions, to be honest, because we're going to look at the anatomy today and the main vessels of the lymphatic system, and an introduction to it. So I'll do it as if people have never heard of it before, and then we'll look more into the lymphoid tissue. So the kind of the filtration centers of the lymphatic system. Good morning, David. Welcome. Welcome to the live session. Cool. And then we've got Tristan in as well. Good morning, Tris. We've got quite a few in this morning. So I mean, God, this is something that you might not have. It's kind of like one of those things where there's a couple of questions on it, usually on an exam, so you quickly revise lymphatics and then know enough to pass. So hopefully this will be a bit more of a deeper dive into that. You take from this what you want. If you do kind of lymphatic drainage type techniques, VODA techniques, that kind of thing, then maybe the anatomy of the region will hopefully give you a greater understanding of what the lymphatic system does, and potentially the role that manual therapy has on the lymphatic system. And yeah, I'm looking forward to that one. Good morning, Jane. Morning. We've got quite a few in this one. It's good. Right, so let's get going then. It's going to be a bit PowerPoint heavy. I do apologise. Just move my mic a little bit. But there's no way around it. It's like I said. There's only there aren't very many cadaveric. There aren't very many at all cadaveric dissections of the lymphatic system. And when you go to the labs as well, so if you come with me to the anatomy labs in London, again, you might be able to see some, but again, what they usually do is that they colour them, so that you can see what they look like. So let's just do a little bit of an intro, and then we'll talk about the whereabouts they are. Okay, so whereabouts you'll be able to influence the system. Okay, so let's start with that. So let's get my arrow up here. So yeah, if you don't know, first time in, for David, welcome. So we run 3 companies basically. We run sports massage education. So this Learn Anatomy Online forms part of our sports massage training as well. And so we teach level 3, level 4 courses. and then a diploma course as well, which is the main movement therapy diploma. All get access to Learn Anatomy Online as part of their standard education for anatomy. Okay, so we already do a little bit on lymphatics within the sports massage course, but I've never really delved this deep into it before. So it's good because it gave me a chance to kind of refresh everything and refresh my knowledge as well. So we're going to do an introduction to the system then, and it's going to be split into 4 parts. But I think today all we're going to be able to cover is the anatomy and function, because it there's quite a lot to it. So yeah, and I think there's enough in just the anatomy and the function to keep us going for around about 40-45 minutes. But you need to understand that before, and then we'll go into the lymphoid tissue, which is where the immune response comes in. And you need to understand that before we get into things like pathologies. So when things go wrong with the system, and then obviously the clinical and lifestyle implications, things that will affect your lymphatic system. Depends on whether you have a disease or a certain lifestyle trait that will influence how that system functions. Okay, so the anatomy is the first thing, as always, of course. And then once we start to understand the anatomy, we can start to look at the function, and then you can start to question the validity of the things like manual lymphatic drainage. Okay, so we'll have a look at that as well. Good morning, Penny. Welcome. Cool. So so that's the plan. So focus on number 1, and then next week we'll have a look at 2, 3, 4. Okay, and probably do a bit of a recap of 1 as well. See how we get on this week. So if you need to, if you don't have it already, then all of the information from today's session, other than a couple of little bits, but most of it, the majority of it, is from this Bible. So this is the Principles of Anatomy and Physiology by Tortora and Derrickson. We always used to say it's the Tortora book. And so if you've never heard of it before, grab your phone, there's a QR code, that will take you through to Amazon. It is an expensive book, but I have had mine for 25 years. I think something like that. They're on something like the 17th edition. I don't know what one mine is, but it's a bit dog-eared now. But the thing is with anatomy and physiology, it doesn't change. It is what it is. We unless there's obviously some kind of major breakthrough with science and things get updated. But we know enough about the anatomy and physiology of the body to say, yeah, this is pretty much how things operate. Yeah, there might be a few things that we're not sure of. So if you buy this book, I think it's about 50 quid. It will last you throughout your career pretty much. So if you need to go back to anything, then this is a really good book to get. So that's where the information is from. So I've not put any references in the PowerPoint, because it would have just been the same reference all the time. Okay, so it's this book. Okay, so let's get going then. So we're going to have a look at the anatomy and function of the lymphatic system. Just move me out the way there. Just lock that before I move it. There we go. Cool. So what we're going to have a look at initially is and these are going to interchange a little bit. So what I've tried to do is create a bit of a flow, which is good for lymphatics, a bit of a flow. So what lymph is, what lymph nodes are, because you might have heard of those things, the lymph vessels, and then going into lymphoid organs. And again, next week we'll explore lymphoid organs, lymphoid tissue a little bit more. We have to touch on it today because we're looking at lymph nodes. But yeah, there are other organs that we won't mention today that we will do as we go through. Okay, so that's a bit of an overview. There you go. Yeah. So if you divide 50 quid by 30 years, then it's a good return on investment. Okay, good on you, Mo. Perfect. 16th edition now, is it? Cool. There you go. So 50 quid. And honestly, it's if you have that and the Trail Guide book. The Trail Guide book is, I think it's good. It doesn't. It's not mega in depth, but for manual therapists and physiotherapists, osteopaths, that kind of thing, I think it's a good. There are other books where I kind of nick bits from, but Trail Guide is really good. Tortura is really good, and if you've got those two, then you're pretty much sorted. Cool. So, what is the lymphatic system then? So, what it does is it kind of works with the circulatory system. Okay, so it assists in the circulatory within the circulatory system, maintaining blood pressure. Okay, maintaining balance of fluids, basically. Okay, so you might have heard of something called lymphedema, or just edema, and basically that just means like a swelling. And everybody will have gone over on their ankle and it would have swollen, or you've seen someone do it. So that kind of swelling you get, hopefully after today, you'll understand why that is occurring and why we get that kind of puffiness around an injury. And so that this is really useful to understand for tissue healing and the healing process, but also disease processes when things go wrong with the lymphatic system, and things go wrong with the circulatory system, because that's really important to help lymph movement as well. Okay, so so it also helps defend the body against disease causing agents. So it is a kind of first line of defense for your body to detect pathogens. So any kind of things that have invaded your body or any kind of disease processes. Okay, so it's a monitoring system, and it is a fluid management system. Okay, so those are some of the key things. So here we are, 3 primary functions. So it drains excess interstitial fluid. So I've literally just taken this from the Tortura book. I've tidied it up a little bit, but let's break down some of these words. So interstitial fluid is fluid that is in between the tissues of your body. So when you know, we always talk about breakdown of nutrients when we eat, and then those nutrients are then passed through to the bloodstream, and then the blood then carries the nutrients into the muscle tissue or whatever it is. Okay, so sometimes there's excess fluid in that transport network, and also sometimes there are molecules from the digestive system that can't pass through the capillaries, the normal blood network. So they're too big to get through the capillary walls. So they need another way to be able to get into the bloodstream and to provide nutrients around the body. And that's where the lymphatic system comes in. So when, like, normally if you're having nutrients delivered to the tissues of your body, they get delivered via the interstitial fluid. So this fluid is in the capillaries of the blood, and then it leaks out of those capillaries into the surrounding tissue, so kind of like a tissue soup. And then the cells of the tissue then mop up those nutrients, use them for metabolic processes, whatever part of the body it is, and then there's waste produced from that interaction, and then that would then go back into the bloodstream and then taken back to be cleaned up or excreted or whatever it is. So in that in between phase, when things leak out of the blood and into the spaces in between the capillaries, that's where the lymphatic system is. That's where it kind of lives. Okay, and that's where its main role is in terms of excess fluid. So maintaining the balance of that excess fluid. So lymphatic vessels drain excess interstitial fluid from tissue spaces and then return it back into the blood. And the way that it returns it depends on where it is in the body. All right, and we're going to have a look at that in a bit more detail today. So this closely links in with the cardiovascular system, as I said. And what you'll find is that if you have someone who is unwell, so they have some kind of cardiac disease, some kind of lung function problem, or some kind of heart failure, one of the key signs that you'll see is peripheral edema. So where the legs will start to swell or the feet will start to swell. And it's not because they've gone over on their ankle, it's because their pump network doesn't work very well. So it's one of the things where if you're looking at someone's overall health, that will give you a good indication that something isn't quite right. So, and usually with a systemic problem, so a problem with your body system, it's not just one leg or one arm, it's both, unless there's a specific injury to the one. So if you roll your ankle, the other ankle isn't going to get swollen, yeah, because there's nothing wrong with it. But if you have a problem with your heart and your heart can't produce enough blood pressure to help with the movement of fluid alongside the lymphatic system, both legs will start to swell. Okay, because it's a system problem rather than a right side or a left sided problem. So things like knowing how this system works will help you with some identification of some ill health. Okay, so that's another key thing for, especially if you're working in sports massage, sports therapy, even in the fitness world as well, where it's not really the remit, but you'll spot things that aren't quite right. Yeah, so that you might notice. So without this function, the maintenance of circulating blood volume would not be possible. So if you imagine this fluid is coming out of the capillaries, so as it's delivering nutrients to the surrounding tissue, so it's got down to the capillary bed, surrounded by let's say it's a muscle, so that you've got capillaries going into the muscle. The fluid is leaking out of the capillaries with its nutrients, and then the muscle tissue is then picking up those nutrients and using them to create movement. And then once it's used it for that purpose, then we've got the waste products coming back in. So sometimes those waste products that have been produced, they're too big to go back into the capillary network, so they can't get back into the bloodstream. Or sometimes there's just too much, so there's too much fluid for the blood network to cope with. And so what will happen is the lymphatic system will help out with that maintenance of fluid. Okay. One of the other key things it does, and this is really important, is the transport of dietary lipids. So in the small intestines, this will take you back. There are something called microvilli, and this is, we hear about the small intestines. If you laid it all out, you'd be able to wrap it around the world or whatever it is, and that's the reason why, is because rather than it just being a tube, it's a tube with lots of little bumps in, and all those little bumps create crevices where it increases the surface area of the small intestine. And those little bumps are called villi, microvilli. And within those villi are capillaries, because the small intestine is where there's the transference of nutrients into the bloodstream. And within that, the capillaries as well are lymphatic vessels. And lipids, so fats, are too big to go into the capillary network. So they can't access the blood supply via the localized capillaries in the small intestine. They have to get into the blood via the lymphatic system. Okay, and that's the only way they can get in. So the lymphatic system has a role in transporting dietary lipids and lipid-soluble vitamins, so A, D, E, and K, that are absorbed by the gastrointestinal tract, and that's because they're too big for the capillaries. Okay, so they can't get in there, so they then go into the lymphatic network, and then I'll show you where they go. Okay. And then we've got the immune response. So lymphatic tissue initiates highly specific responses directed against particular microbes or abnormal cells. And this is where we look at masses of lymphoid tissue. But we're not going to go into that today. Okay, we'll go into that on the next session. So those are your three primary functions of the lymphatic system. So, what the hell is lymph? Lymph basically means clear water. Okay, so it is a mainly a colorless kind of liquid, although in the gastrointestinal tract, what we were just talking about with the lipids, it's more milky. Okay, so it's a whiter fluid, but around the rest of the body, it's a clear fluid. So that's where it gets its name from. So this is the network that I was just talking about. Okay, so this is the stuff that you usually see in like a level 2, level 3 sports massage PT exam. Okay, so you'll see that we've got blood network coming in. So we've got the arteries, then the arterioles, and then the arterioles then go into smaller vessels, the capillaries. They form a capillary bed, and then the whatever is in the blood supply then leaks out of those capillaries into the surrounding tissue. That's then picked up by that tissue it's used, and then whatever is like waste products are created, they are then in the tissue, and then they merge back into the capillaries, and then off they go again, but they go via the veins. Okay, so it goes from arteries, arterioles, capillary network, and then once it's all used up, that deoxygenated blood and some of the waste products will go into the venous system and then back up to the heart. Okay, no problem. I will tell you in a bit. That's all right. Where does the lymphatic system transport the lipids to? I will show you that in a bit. Yeah, cool. We'll get to that. Don't worry. Good. So this bit here. So can you see here these little cells all around here? Yeah. So and the bits in between where it's white, that's the interstitial bit. So in between the tissues. So that's where you're going to need fluid. And what fluid is in blood? Blood plasma. Okay, so it's the blood plasma that leaks out of the capillaries into the interstitial fluid with all of the nutrients that get them mopped up, waste products produced, and then into the venous system, and then off you go. Okay, so this is going on all the time, but in between, obviously, lymph is green, so that's these bits here. We have the lymphatic system. All right, and it's wrapped around, it's merged with the circulatory system. It kind of follows the arteries and the veins they all work together basically. Okay, so most components of blood plasma filter through the blood capillary walls to form interstitial fluid. So that's from these bits here. Because the capillary walls are only a cell thick, things are able to diffuse across. So if you've got a high concentration of pressure from the arterial supply, and there's a low concentration of pressure in the interstitial fluid, things will pass across that membrane to balance it all out. And then if you've got too much pressure then in the interstitial fluid, which is greater than the capillaries, then it will start to merge back. But if there's too much fluid in that particular area, or some of the molecules are too big to pass back into the capillaries, the lymphatic system will pick up the rest of the fluid. Okay, so within your body every day, from your blood network going into the interstitial fluid, there's 20 litres of fluid that will pass from your blood network into the interstitial space. Okay, so 20 litres every day. 17 litres will pass back into the bloodstream and go on its merry way, so via the venous system. So it leaves a difference of 3. And that's where your lymphatic system picks up the slack. So the lymphatic system deals with the additional 3 litres to balance everything out and keep all of the fluid maintained. Okay. Yay! You did. Yeah, you did need to know it. See. So after interstitial fluid passes into the lymphatic vessels, it is then called lymph. So interstitial fluid is lymph. Lymph is interstitial fluid. It just depends on where it is. Okay, it's very similar to when we look at a blood vessel, like we did with the knee the other week, and you've got the femoral artery because it's around the femur, and then when it goes behind the knee, it's the same artery, but then we call it the popliteal artery, but it's the same vessel. So it depends on where the location is, and that's exactly the same with this. So when the fluid is in between the tissues, it's interstitial, and when it's in the lymphatic system, it's then lymph. Okay, so that's where lymph comes from. So the major difference between interstitial fluid and lymph is the location. There you go. Interstitial fluid is found between the cells, and lymph is located within lymphatic vessels and lymphatic tissue. So it's the location that gives it its name. All right, so it's not some mysterious thing that's created. It's exactly the same stuff. It's just been pushed into a different system. Okay, and that's why it's given that name. Cool. Okay, so this is a bit of an overview of how the whole flow of lymph works, and I'm going to refer back to this a few times whilst we go through. So we've had a look at the blood capillaries already, so we've just seen the picture of that. From the blood capillary network, the plasma then leaks into the interstitial space, so that's this interstitial fluid. Then, if there's excess fluid or the molecules are too big to go back into the capillary network via the veins, then it goes into the lymphatic capillaries, which were those green ones that you just saw on the last image. And then it's called lymph. Okay, so we've got blood, first of all. Then as the blood plasma, because red blood cells are too big to pass through the capillary walls. So it's only the fluid that can get across. So again, we've got molecules that stay in the blood because they can't transfer either. Okay, so smaller molecules will pass across. So it goes from blood into interstitial fluid because it's not really in a vessel. It's kind of floating in between. Then, depending on the pressure gradient via osmosis and diffusion, it then passes, or osmosis rather than diffusion there, via osmosis, it then passes through into the lymphatic vessels. When it's in the lymphatic vessels, the first ones are capillaries because they're the smallest ones, and then it's called lymph. Then it goes into bigger lymphatic vessels. So those are like your arterioles and your venules and your veins and arteries. Then it goes into what we call a duct. So that is like a depositing place. Okay, and we'll explore that in a second. But there are two main ducts where the lymphatic fluid will go. Then it goes into the internal jugular vein, so up around the neck. All right, we'll talk about how it gets there in a second. And the subclavian veins, because there's a kind of junction between those two veins. If you've not seen that before, then have a look back at the blood supply of the shoulder, and on that video it shows you where the subclavian and internal jugular veins are. Okay, and at that point where they both meet, and then it forms the superior vena cava, so the main vein going into the heart. So you've got the subclavian and internal jugular meeting there. At that point where they meet is this point here. Okay, and that is where your lymphatic your lymph fluid will drain back into your blood network again and go into the heart. Okay, and then it's in the blood again, and then it all goes around again. Okay, so what we're going to do is we're going to break down this cycle, and each stage we're going to have a look at what's happening at each of those. Good question. Interstitial fluid, also called ground fluid. I don't know. I've not heard of that term before. I'll have a look. I don't know. Sorry. I've not heard of ground fluid before. Right. Cool. So let's have a look at the different lymph vessels then. So lymphatic vessels begin as lymphatic capillaries. So we're at this stage of the flow. Okay. And that's what you just saw on that last image. where you had the capillaries from the arteries and the arterioles. Then you had that transference across into the venules and the vein capillaries, and then in between you had all the lymphatic capillaries. So that's where we are right now. Lymphatic capillaries have got greater permeability than blood capillaries and can absorb large molecules such as proteins and lipids, so proteins and fats. And that's what we were just talking about. Okay, so the structure of the lymphatic capillary walls is slightly different to the blood. They're a bit looser, so they're able to get bigger molecules into the lymphatic capillary network. Okay. Lymphatic capillaries are also slightly larger in diameter than blood capillaries and have a unique one-way structure, so very similar to veins. So once it's in, it ain't getting out. Okay, and unless obviously there's something wrong with it, there's some kind of pathology. But once it's in, and then the pressure then increases in those lymphatic capillaries, it closes up the sides of the capillary walls so that it can't get out again. Okay, and again, that's to do with the pressure differential. So if there's low pressure in the lymphatic capillaries, high pressure in the interstitial fluid is going to go into the capillaries, the lymphatic ones, and then once the pressure builds up in those, the capillary walls will close, and then they're kind of in the lymphatic system then, and you can't get anything else in, and you can't get anything else out because it's all locked. Okay, it's locked in place. So that's where we are here. Yeah, so it's a structure that permits interstitial fluid to flow into them, but not back out again. Okay, we obviously don't want leakage. Once it's in, we want it to stay in. So that's where we are right now. Here we go. So this is a bit more of a zoomed in version of what we just saw. So here are the cells again. Here's the interstitial fluid, so all the fluid around the outside. And you've got these little anchor points here, so anchor filaments just there, and they will attach to the surrounding tissue to either is to keep the structure of the lymphatic walls in place, so they don't move around. Because obviously, if that wasn't attached to something, and that's the side of the cell wall just there, can you see where they just overlap slightly just there? Yeah, and then there's another one just overlapping here. So if they were allowed to move, if the sides of the lymphatic capillary walls were able to move within the cells, then the integrity of the walls just wouldn't be there. So when there's lower pressure, it will kind of slacken these anchors. So when there's low pressure in here, and then that will then start to create an opening on the sides of the capillary walls here. So then the fluid can then get in. And then once the fluid then starts to fill that lymphatic capillary, it will push out against the sides of those walls and then close up those spaces where things were able to get in. Okay, so when pressure is greater in the interstitial fluid than in the lymph, so pressure is greater here than in here, the cells separate slightly. So these cells here, it's really annoying because those black arrows are just covering the edge of the cells. Like the opening of a one-way swinging door, yeah? And then the interstitial fluid enters the lymphatic capillary. So from here, it then goes through that gateway, okay? So follows the arrow and then goes into the lymphatic capillary. And that's how it gets in. When pressure is greater inside the lymphatic capillary, the cells adhere more closely, but because they basically like stick together. So it's like an overlap like this. And then when they're not full, they're kind of loose. And then when they start to fill, they create a structure that's less permeable. Okay, and the lymph can't escape back into the interstitial fluid, so it's kind of been caught. The pressure is then relieved as the lymph moves further down the lymphatic capillary. So as it's moved along, and we'll talk about how that happens in a bit, that then blocks it off. So then off it goes on its merry way. Okay, cool. Good. Thanks, Daniel. Oh, is that Becky? I was going to say, thanks, Daniel. Who's Daniel? No problem. Well, do you know what? It's one of those things that I did like years ago. And I don't know whether the person who taught, I don't remember being taught it. And I don't. So obviously they weren't a very good teacher because it didn't stick in my mind. It might have been just one of those ones where it's right, read Tortora and learn about lymphatic. So I'm glad you enjoy it. Joe, I really enjoyed putting this together. It was good. Yeah, here we go. So these are the anchoring filaments here, these bits here. Yeah. So these attach anchoring filaments which contain elastic fibers. They extend out from the lymphatic capillary, attaching lymphatic endothelial cells to surrounding tissue. What the hell does that mean? So these cells here, so that one there, these are the lymphatic endothelial cells, okay? And they're basically attached to the surrounding tissue by these anchor points. So when excessive interstitial fluid accumulates and causes tissue swelling, the anchoring filaments are pulled, making the openings between cells even larger so that more fluid can flow into the lymphatic capillary. So that's important if you've rolled your ankle. Yeah, so if you've had tissue damage, so some of these cells have been injured, you then get an increase in blood flow to that particular region because of the chemical reaction that's going on. The blood vessels, the cell walls of the blood supply, are made even more permeable so that you get more plasma into the area, so more fluid. So the lymphatic vessels respond. So as things swell, because of these anchor points, oh, there we go, anchor points here, they will make the gaps wider to get more fluid in. Okay, so that's really useful to know if you deal with injuries. Yeah. I know what you mean, Penny. It's quite like abstract conceptions, these things, because you have to kind of think, well, this is going on, and it's like microscopic stuff. And yeah, how the hell is that happening in my body? These are the ones in the small intestine. Okay, so here's your microvilli. There's your small intestine. So that'll be one bump along your small intestine wall. Okay. You've got lipids in the small intestine, so fat molecules, and they will pass through the villi and the microvilli, trying to get into the bloodstream. And again, it's all to do with balance of pressure. So if you've got more pressure on one side, less pressure on the other, then things will move across the membrane wall and move across here. So here we've got lipids trying to get their way into the bloodstream, but the capillaries for the bloodstream can't accept them because the molecules are too big. Okay, so this is a lymphatic capillary that is in your small intestine that will receive those lipids so that it can then pass it then into the circulatory system. All right, so that's how you'll get your fats into your system. So in the small intestine, we've got specialized lymphatic capillaries called lacteals. They carry dietary lipids into the lymphatic vessels and then ultimately into the blood once they've all been checked out. So they get checked out here in something called a lymph node. And I'm just going to leave that there. We'll explore those in a bit more detail in a sec. But this is like a it's not like a filtration system. Kind of is. It's a bit more like a checking system. It's like customs. Yeah, so someone checking your passport as you go through, go, yeah, you're clear, off you go. If there's a problem, then the one of the first line of defenses is your lymphatic nodes. Okay, and we'll talk about those in a bit. So the presence of the lipids causes the lymph drainage from the small intestine to appear creamy white. So like I said before, usually lymph fluid is clear, but in the intestines, because of the lipids coming in, it's a different color. Okay. It's referred to as chyle, which is a juice. Elsewhere, lymph is like a clear, pale yellow fluid. And it's a bit like cerebrospinal fluid. Hopefully you never see that because it should remain around your brain. So it's it's usually a clearer fluid. Right, what time is it? Oh my god, it's like 20 to 11 already. Okay. Lymph nodes. Let me do something else. I'm going to skip forward a bit. Let's go through those. I want to get to this bit because of Becky's question from earlier. Okay, so where are we right now? We are here. Yeah, so here's back to our flow. I really want to get this bit because this is really cool. So we've gone from here. So we've had a look at blood capillaries and the plasma in the blood and all the fluid in the blood leaks into the interstitial space, but that's supposed to happen. It's not a bad thing, but it should be controlled unless there's obviously an injury or a disease. It leaks into the interstitial space, so in between the tissues, with nutrients so that it can supply nutrients to the surrounding tissue. The excess fluid is picked up by the lymphatic capillaries, and when it's in the capillary vessel, which is what we've just seen, it's then called lymph. Okay, and then similar to the circulatory system, where we've got capillaries, arterioles, arteries, we've then got bigger lymphatic vessels that then start to carry this lymph fluid back into the circulatory system. Okay, so we've got lymphatic capillaries, which we've just seen. Now we're into this area here. Well, these two really. So this one first, where the lymphatic vessels, the first bit are called trunks. Okay, so I don't know whether you saw. Somebody will appreciate the picture. We've got trunks and ducts. Okay, I had to do something to entertain myself on this. Okay, so we've got lymphatic trunks here, and then they then go into ducts. Okay, so let's have a look at the trunks. So the trunks are coming from here. We've got a lumbar trunk and we've got an intestinal trunk. These are the main ones. Okay, but I'll have a look at some of the others as well. And then we've got a bronchiomediastinal trunk. Okay. Again, we've got a really long word. Basically, that means from the bronchial region, so from the lungs, and the mediastinum, which is kind of the area that, like the thorax area. Okay, so those are the ones that are on this particular picture. There are some other trunks as well. So let's have a look at those. So lymph passes from lymphatic capillaries, which is what you just saw, into lymphatic vessels, through lymph nodes, which we haven't covered yet, but we will do. And then lymphatic vessels exit the lymph nodes in a particular region of the body. And then they all then come together to form lymph trunks. So if we relate it back to blood supply, it's like the it's like the arterioles going into the arteries. Okay, so it's that kind of part of the network. Okay, so the principal trunks, we've got lumbar. So we've got lumbar trunks coming in here. There's a left lumbar trunk there as well on that image. And then we've got an intestinal trunk. So all those lipids that are picked up from the small intestine, they will be transferred into the intestinal trunk and then into the lymphatic system, which runs along your spinal column, sorry. Then you've got your bronchiomediastinal. Okay, so that's this region here. So I've got another image here. This blood network here, this is from your neck. Okay, and it's flipped because obviously in your body it's the other way around. So this is the left side, even though it's on the right side of the image, and this is the right side. And this vessel here, this is a subclavian vein. So subclavian means underneath the clavicle. And then we've got a jugular vein as well, which is internal jugular just there. And then we've got the same on the right side. Okay, so we've got bronchiomediastinal trunk coming up. So where is it? Just there. Okay, so that lymphatic, I just about make it out. My eyesight's getting really bad. I'm gonna have to wear glasses. So that one just there. Can you see this network all kind of linking together? So all these trunks linking together, and then you've got a left subclavian trunk. Yeah, so that's around that region there. So they're following the vein network, because what they're going to do is they're going to dump the lymph fluid into the venous system. We'll get to that in a sec. So we've got those, bronchiomedial-sternal, subclavian, and jugular trunks. So we've got 2 main trunks for the lower body, 3 main trunks for the upper body, and then a network that joins them all together, which we'll have a look at when we look at the ducts. So the lumbar trunks drain lymph from the lower limbs, the wall and viscera of the pelvis, the kidneys, sorry, my camera's in the way, so I have to keep moving my head, the adrenal glands, and the abdominal wall. So all of that kind of abdominal region, is all of the lymph from there is drained into the lumbar trunks. Okay, the intestinal trunk drains lymph from the stomach, the intestines, the pancreas, spleen, and parts of the liver. So it's kind of split into 2. So all of those, that kind of midsection area, all drains into the lumbar and intestinal trunks. Okay, let's do the next bit. Quickly go on to ducts, and then we'll pick it up again next week. So the bronchomedial sternal trunk drains lymph from the thoracic wall, the lung. Let me just move me out of the way, and the heart. Subclavian drains from the upper limbs, and then the jugular from the head and the neck. So hopefully you might be able to see that image a little bit clearer now. So there's your left brachio medial sternal coming in there. There's your left subclavian all coming in there, and then there's the left jugular just coming down from the head and neck there. And can you see it's all coming together around this vein here? There's the internal jugular vein, there's the subclavian vein, so that's on the right side, and we've got the same on the left. That there is your superior vena cava. Okay, so what's going to happen is all of the lymph from that region there, so where are we? So this is from thoracic wall, lung, and heart. All of the stuff from the subclavian, which is the arms, and then the jugular from the head, is all going to join together and then be dumped into the vein around here. Okay, so all around that area there. And this is how it drains in via the ducts. Here we go. So back to our flow. We'll do this and then that's it. We're done. Okay, so we've got a right lymphatic duct coming into the right side. So that's where we are right now. So what we just did with the trunks, so they were coming in from all the different various parts of the body, and then they then form a duct. Okay, the right duct there, and then the left duct there. Look at the size of that one. So the left duct is called the thoracic duct. So let's have a look at that. So we've got 2 main channels. Where's my arrow down? There we go. So lymph passes from lymph trunks. So all those bits that we just saw before from the intestinal and the lumbar and then the upper body and the head and the arms, they all then come into 2 main channels. The thoracic duct, which is this one. Okay. Massive long duct there. So let's have a look. So the thoracic, the left lymphatic duct, is 38 to 45 centimeters long. It travels from your lumbar spine all the way along the front of your vertebra, and then into that part where the internal jugular vein, subclavian vein come together, and then it dumps all of the lymph into that bit of the vein just there. So everything from here, all of that is all of that part of your body. Okay, can you see all that bit that's covered in green? So the left side of your face, your left arm, and all of your lower limb, and all of the intestines, and all of the viscera, all drains into that left side. The right side, so that right lymphatic duct, is the right arm, the right quadrant of your chest, and the right side of your face, and that drains into this bit here. Okay, so this left side from the left thoracic, or the thoracic duct, okay, all of that is coming for all of those bits of your body. So any fluid from all of that area of your body is passed up through that lymphatic duct, the thoracic duct, and then put into the venous system, so back into the circulatory system, at that point on the left side of your body. Okay. The thoracic duct is the main duct for the return of lymph to blood, and there's something called the cisterna chyli, which receives lymph from the right and left lumbar trunks and from the intestinal trunk, and that's that bit there. So that's that is like a thickening, like a pouch. Okay, where it kind of collects from the trunks, and then from there it's then pushed up into the duct, and then back into the venous supply. Does the right include? No, right doesn't include the liver. No, so anything below the diaphragm is left. Okay, so it's just the right kind of side of your lung. Yeah, so that from there, so anything above the diaphragm and right arm. All right, that's a good question. But yeah, the liver, anything visceral is all coming into the left, or the thoracic duct. Good. Cool. So in the neck, the thoracic duct also receives lymph from the left jugular, left subclavian, and left bronchomediastinal trunks, which we looked at before. So that was this side. And then the thoracic duct also receives lymph from the left side of the head, neck, chest, left upper limb, and the entire body inferior to the ribs. Okay, so everything underneath that diaphragm area. Thoracic duct in turn drains lymph into the venous blood at the junction of the left internal jugular and left subclavian veins, which is this bit just here. Okay. Whew. I think that will do. I've really enjoyed that today. It's good to do something different. Hopefully that's been useful so far. I had a feeling when I was putting this together, I was like, this is going to be more than a wanna. So we will pick this up next week. Feel free to ask any questions, because there's obviously a lot to do. It's kind of like oh my god, there's a whole new world to learn about in anatomy. But yeah, any particular questions and you're not really sure what I was talking about, then I can go over that. So we'll do a brief overview next week of what we've covered so far, and then we'll go over trunks and ducts again, and then we'll start to go into lymphoid tissue, okay, and have a look at how blood is filtered and lymph is filtered. Okay, cool. See you next Monday at 10 o'clock. See you then.